This is a 2023 multidisciplinary review in long COVID in children, where we know that children are affected by long COVID, and these can include problems in school performance and their daily activities. Within the US, 18.2% of cumulative cases of long COVID are in the pediatric population. Inclusion criteria for this review are individuals having to be 0 to 18 years of age, written in the English language, and could be found in PubMed or Google Scholar. In 21 cohort studies with a total population of over 80,000, the persistence of long COVID symptoms in children is around a quarter of those that were infected with long COVID, or should I say with a COVID infection, and then got long COVID. Children with respiratory predominant long COVID have persistent cough, fatigue, and very labored breathing that's hard to do. Factory dysfunction or smell disturbance is around 5.6 to 12.3% of children with long COVID. Nasal congestion occurs in about 16.1% of children with long COVID. Tinnitus, vertigo, and earache are present in long COVID, but they're a low prevalence of about 3%. Another low prevalence is sore throat, having an abnormal voice, or difficulty swallowing occurring in about 2%, 2%, and 1% respectively. For gastrointestinal issues, about 5% of children and adolescents have these, with constipation being 2%, chronic diarrhea being 1.5%, about nausea and vomiting in about 1.5%, and then swallowing difficulties in only about 0.5%. For cardiologic symptoms of long COVID, we have orthostatic intolerance in about 7%, exercise intolerance in about 6%, chest pain in about 5%, tachycardia in about 2.5%, and then palpitations in 1.2%. For common motor syndromes, fatigue is the most common, affecting about 10% of children with long COVID, which can include attention and learning problems, in addition to mood alterations and sleep disorders. And last but not least, up to half of young patients experience headaches and an altered mental status with long COVID, where 5% of this population ends up developing seizures, encephalitis, or other demyelinating disorders like meningitis. These are all the different things that can happen for children with long